Welcome everybody to Fireside Chat Friday here at Coronado Psych, where we talk to our different expert psychologists and providers about their areas of specialty, and so that everyone can get to know them a little bit more. Today we are so grateful and excited to have Dr. Diana Graham joining us for a nice chat by the fireplace, which I can't move my hand. There we go. Is right here. And so welcome. I am excited for the day when we eventually can do these in person. But for now, it's wonderful to see you.
Thank you. You too.
And yeah, I guess we'll just start off by having you kind of introduce yourself. Tell us a little bit about who you are, what you're about, and we'll just take it from there.
Yes, thank you. I mean, I'm very jealous. I don't have a fireplace where I am, so I definitely can't wait to do this in person. But yeah, so I'm Dr. Diana Graham. I am a licensed pediatric psychologist here in California, originally from San Diego, so my whole family's there. But I trained actually in Colorado and in Baltimore as well as in California. So I've been a few places throughout the United States, working in children's hospitals and training in children's hospitals. Working with kids with a range of health issues.
Yeah, awesome. So yeah, I'm so excited to talk to you today because I feel like your area of specialty, it makes so much sense once we think about, what it's like to be sick and then to be a kid and then putting those things together. But, I just wanted to give you an opportunity to tell us a bit more about what is pediatric health psychology, and what does that even mean for those of us out here who might not know as much about it?
Absolutely, yeah. So you might see us in lots of different places. So pediatric psychologists, like we do outpatient therapy, but we also are integrated into a lot of like medical clinics. I've worked in inpatient floors of a hospital. So we're really, really integrated into medical teams as well as doing therapy with kids who have chronic or acute health issues. So the pediatric part often, will mean like generally, kids who have, say, diabetes or cancer, asthma, really any medical presentation. And you're right. So I would say maybe in the past, you might correct me, maybe in the past 15 years or so, I think there's become just more of this awareness and push that, hey, look, having a medical condition is really hard. And there's actually higher rates of depression and anxiety and whatnot, and even trauma in these kids and teens. So we do a lot of like mental health screening, especially in the medical clinic. So what that might look like is just, hey, let's just check in with you and just see how you're doing. And like, let's look at, how much anxiety or worry are you having about your medical treatments? How much anxiety or worry are you having about having to go to the doctor even, right? Some things that can be really painful for your kids and teens. So we try to be as integrated as possible, which I think is one of the awesome benefits of having a pediatric psychologist around, so that we work closely with the doctors too, right? It's not just kind of one and done situation. We really try to be fully integrated.
Yeah, absolutely. And in terms of, so there's the assessment piece, where, you might be asked a bit more questions about your experience versus like necessarily your physical symptoms only, which is sort of a more, how it, I guess, used to be way back when, right? But now that we know better about the mind-body connection, it's great that you're a part of these teams to be able to assess and flag and say, okay, I think, this patient might need a bit more support, or this family might need a bit more support. Can you tell me a little bit more about like then what happens? Like what usually happens with that type of information, or how does like pediatric health psychologists help in terms of therapy?
Yes, absolutely. So generally, say it depends on where we meet, but say we meet in a medical appointment, and yes, I ask you about your experience and ask you lots of questions about how, when did you start having to do treatment? How has that been for you? kind of depending on those answers, we'll give recommendations and we'll talk to the family about like, hey, so your child has been, expressing just a little bit more difficulty adjusting to, having to take insulin every day, right? The needles are scary. It feels weird when the insulin goes in. They have to constantly think about what they're eating. They're really having a hard time. And we're a little worried about what that might mean down the line. Right? The harder it remains, and they maybe don't have a little more assistance adjusting. So we worry that could be harder for them as they get older to manage it. So we'll give, depending on the severity of the symptoms, we might just see them in clinic. We can do kind of follow-up sessions. We can do brief short-term therapy. Like right now, we're more accessible than ever because we're doing teletherapy on our computers. Or if we think that maybe there were some pre-existing concerns for anxiety and now they also have a medical condition, so this has just got like maybe worsened it, we would probably refer for regular therapy. So really trying to provide longer term therapy to work on that anxiety and the adjustment to the medical issue. And then there's lots of other resources we can refer to, right? It doesn't always have to be therapy. It could also just be social groups or engagement in certain activities to get like some of that pleasure back and joy back into their life that maybe they've pushed away a little bit because they were diagnosed with a medical condition.
Yeah, absolutely. And, obviously I'm not a pediatric health psychologist, but being a health psychologist myself, I feel like it's just so important sometimes to talk to other people and meet other families who are going through something similar. It might not be the exact same diagnosis or exact same treatment course, anything like that from the medical side of things, but it's nice to connect with other people. So support groups and things like that, I think, are also probably things that you all recommend as resources on occasion when it makes sense.
Absolutely. That's a big thing, especially for, we call our AYAs, or adolescents and young adults. So, I mean, it's really hard being a teenager already. And so having a medical condition on top of that makes it even more challenging. So we actually have a program at other places I've worked where you can actually connect them to another adolescent or young adult who's had a similar medical condition, and they can be sort of their partner or support or companion to help guide them through what's going to come.
That's awesome. That's awesome. One of the things that I think that people don't necessarily realize is that, just the strong links, we talk about mind-body connection, and obviously there's the physiological stuff and all of those complex systems. But on a basic level too, I feel like in terms of my work with adults, I recognize that there's a big link between how we think and feel about an illness and what we actually do about it, in terms of adherence to recommendations and how they even communicate with the doctors. Is that the sort of thing that you might cover as well in your work with families?
Kind of, yeah. So like adherence or following like medical recommendations. Yes. So so obviously, I work with little kids and teens and young adults. So it's quite a age range. So yes, we'll see a lot of the patients and the families understand what they have to do. So often it's like I always say, knowledge is necessary but not sufficient for change, because we often know what we're supposed to do, right? We know we're not supposed to use our phone lying in bed and all that stuff, but we still do it. And so that's kind of what a psychologist does too, right? Especially a health or pediatric health psychologist. We're trying to figure out that barrier. So, right, it's not knowledge. It's not, is it like confidence? Is it they don't think they have the ability to, they think they're going to have this expectation to fail? Are they not tying their values to their medical treatment? And for littler kids, right, we really try to partner with the parents on those same types of concerns, right? Are they overwhelmed? Do they not have that support? How can we sort of integrate ourselves to get them more resources to provide them that support with their child's new diagnosis?
Yeah. And as we're talking about this, I'm just thinking about how hard it must be, especially for, the adolescents, sort of young adults transition, right? Because you're trying to, gain your independence and autonomy and take a bit more control of these things in your life that maybe historically you've had, parents or other family members helping with. So I can imagine that, the needs for a pediatric health psychologist might change over time. It might not be at the initial diagnosis. It might be later on down the line as people are trying to kind of figure out, well, what's the balance here between, micromanaging versus, letting people do their thing. And then also kind of being concerned about, okay, well, are people following what they need to do to stay healthy, and et cetera, et cetera. So, I don't know if that's something that you see or, yeah.
Oh, yes. Oh, my, absolutely. I can't. So healthcare transition is a huge thing right now for you because, we used to just we have our pediatric doctors and we have our adult doctors. And back in the day, they would just kind of be like, okay, you're 18 now, go see the adult doctor. And we've really noticed over the years that is very difficult, especially when you grew up with an illness and you're used to the pediatric team. It's like your family.
Sure.
So that's really hard to tease apart. And then insurance, I don't know. I still struggle with understanding the health insurance world. It's hard. And so teens and young adults have to figure that out. They have to remember now to manage their own appointments. So it's really challenging. So we actually have a lot of research and now some programs actually opening up in the pediatric world, trying to connect pediatric to adult providers. So it becomes more of a system transition versus just a transfer, okay, bye. It becomes more of a transition in a process.
Absolutely. That's absolutely incredible because you can just see, even for somebody who's not facing any sort of illness or having to manage their physical health in any special way. I feel like just anecdotally, that there's a lot of drop off in those young adult years, right? Because, for the most part, if you're healthy, you might not be going in for the checkups in the way that you are when you are little. And then, of course, there's a lot of people out there who don't have things like family doctors and things like that following their healthcare. So I can only imagine just how much more important that is if you already have, a condition that you need to manage. So that's awesome that those resources are there. And I'm so glad that people like you are out there working on it and making sure
we're trying, yeah.
that we all try to stay on track. Obviously we've talked about all the different ways a pediatric health psychologist can help. One of the things that I kind of want to circle back to for a second is that integrated piece. In terms of your knowledge and working with all the other parts of the medical system and how that can be beneficial for patients looking for help with the mental side of things or the emotional side.
Yes, absolutely. I mean, having somebody or having a psychologist really understanding all of the moving parts, I think if you have any experience having to be in a hospital or do any sort of follow-up with the doctor, that not everybody communicates, right? You hope they will if they're through the same healthcare system, but there's just so much going on. They can't always do that, or it's a very complex system. So especially at, children's hospitals, and then there's primary care doctors, and then there's social work, there's physical therapists, occupational therapists. So there's so many people that get referred to a patient for various reasons. And so a pediatric psychologist is really good at, I think, being attuned with these types of stressors, right? I think we go in to assess what supports we can provide in addition to mental health work, and are really good, I think, at anticipating how to work as a group, as a whole, versus in a bunch of independent pieces. So that has been my job a lot too, is constantly meeting with other people of the team, sharing the same information, making sure we're all on the same page, so we're not all separated when we go, and having different messages when we go talk to patients. So that's a very important part of the job.
Absolutely. All the coordination of all the other people, right? And trying to advocate for whatever patient needs there might be that might kind of slip through the cracks. So I love that that you have that experience and that you bring that to your work with your clients, because I think it's just so necessary. It's so overwhelming sometimes. All of the people to see.
I would say school is always a big one, right? So when we get diagnosed, we're like, oh my gosh, what's going to happen to school? That tends to be the first thought, because it's such a stressor. It's a child's job. So I also work a lot with social workers to coordinate, okay, that we can come up with a plan, and it's not going to be our priority for a little bit, but we can figure out how to make sure that it's still a part of your life, and we're not getting, entirely behind on our schoolwork, if that's what's important to you.
Yeah, absolutely. I hadn't even really thought of that, because we don't really have to think about that too much in the adult world, right? I mean, it's usually work, right, related things. Mm-hmm. But for the kiddos, it's the school, obviously, that makes a lot of sense. So, and then, I guess for those, of you who are watching out there who might be thinking about family members or people in their own lives, how would we know that we need to go see a pediatric health psychologist? Mm-hmm. Like how do we even recognize that there's a need there?
Absolutely. And so I tend to break this up into kind of more like preventative and then management. So, sure. So when things are chaotic, or there's a lot of uncertainty, or there are big life changes, that generally will stir up more anxiety and difficulty adjusting and difficulty coping. So if you generally have like a worrier of a child, and then all of these things happen, like, I don't know, maybe COVID-19, right? So something creating all of this change. I tend to recommend trying to like receive some sort of consultation, just to try to see, how the child is adjusting. Are there any sort of elevation in symptoms, changes in behavior, just to be, maybe they're having difficulty coping with everything that's been happening. And more, when I say management, that means more like there are already symptoms pretty strongly present. And we would usually notice that when we see like increases in irritability. So for kids, depression and anxiety generally presents as irritability, right? Mm-hmm. Even though they're internal emotions, the way we think about them, they present differently in kids.
Sure.
And then maybe grades dropping, sleeping more or less, like just really having more sleep problems than usual, appetite changes. So we're just seeing a lot of these big differences in day-to-day behaviors. Those are pretty good indicators that maybe your child's struggling.
Mm-hmm, mm-hmm. Right, because sometimes I guess the kiddos just don't have the same ways to express
exactly
how they're feeling yet, right? Which is why it might come out in these other ways, right? They're frustrated, or they're anxious, or they're sad, but it's hard to express it other than to potentially act out or sleep in, or all those other things that you described just then. So I love the idea of sort of keeping an eye out for those big changes in any of those behaviors for those kids, especially, and this kind of gets to sort of what I wanted to touch base on, of course, is especially given COVID.
Yeah.
And so I guess I'm just wondering, in your experience in this, almost year.
Can you believe
pandemic,
it? I know.
It's wild. But, now that we've had almost a year of this pandemic under your belt, any like specific things around COVID that you see that's sort of different now, different types of concerns that families and the patients have because of COVID, or anything like that? Or
I actually have noticed that while a lot of families have been pretty resilient, the burnout has remained the same, right? So even though it has been a year and we've had time to kind of get used to this COVID way of life, a lot of parents are burned out, because they're now not just parents, they're teachers, they're their chefs at home for every single meal. They're trying to keep their kids entertained while also do their own job. So they are wearing a lot more hats than usual. Mm-hmm. And then the kids don't have a lot of structure. So even virtual learning isn't always as structured online, isn't taking as long. Maybe they just have a couple hours of stuff online a day versus being at school for 5 or so hours. So one of the things I have, emphasize self-care, which could be a whole other talk, self-care for parents. But doing like what I call flexible structure. So daily kind of general structures where you can chunk time. So say wake up time, breakfast time, shower time is like from 9 to 11, right? Or physical activity time, craft time is from 1 to 3 p.m. So chunking these bigger parts of time, so it creates structure, and also allows for some flexibility. So you're not kind of like, oh my gosh, I have to get this done. Now I'm behind on this and I didn't do this task for the day. Letting your child have some flexibility around a general structure. And within that structure, giving them choices. So you might have lunchtime at the same time every day, but have 3 different options for lunch that they get to choose from. Physical activity time the same time every day, but give them 3 different opportunities or 3 different choices for physical activity, which could literally just be a dance party in the middle of the living room. Like it doesn't have to be exerting lots of energy. So I get that's one of the biggest things, because that also keeps parents a little bit sane. Keeps parents a little bit sane and allows kids to have a little more purpose, right? A lot of us have lost our purpose or feeling of accomplishment every day because we don't have that structure. So it gives kids back that.
I love the recommendation of chunking the days, because I think that's probably a great recommendation for just like all of us to some degree, a little bit, just to keep a schedule. But for especially since the days are shorter with these Zoom classes and whatnot, I can totally see how that would be sort of a helpful approach and giving kids the option. I just feel like, COVID generally has taken away so much from our little ones. And, it's just so much choice and options and whatnot. So to whatever degree we can create that for them, I think that's awesome to think about. And then, I think that it's also like the added layer of if you have any kind of chronic illness that you're dealing with, right? In a pandemic, is just so hard. I feel like it's hard, for the patient, but also for like the whole system, right? Because now like the siblings can't, are restricted way more.
Yes. And you're absolutely right. I know that is absolutely something, the children's hospitals have seen, right? Only one parent allowed at bedside at any given time. And you're only allowed to identify one other person who's allowed to visit and switch off with you. Right. So if you have a kid, we might have been hospitalized, unfortunately, more than once. Before COVID, they're used to having so many people come see them and bring them gifts. And now they don't have that. This has been ongoing throughout COVID, as families are afraid to go to the emergency room. So if they have an increase in fever, or if they, say if they are in cancer treatment, they have an increase with fever, they're scared to go to the emergency department. So things like that, where like, we want you to come because you need to, and we understand because it's really scary. We don't want to get COVID.
Absolutely. And I feel like this is where that piece around having somebody who can advocate who can help families sort of figure out ways to communicate with their doctors and vice versa, I think can be so helpful.
Yes.
With all this, especially with sort of the changing nature of everything too. I mean, I just think back to a year and like what we knew, or the little that we knew about what was going on, and how things have shifted over time, and then shifted back, and in terms of restrictions,
constantly changing the second we think we know something. Yes,
absolutely, and it's just it's a lot to deal with, and I think I'm hoping that for whatever it's worth, there can be a little silver lining about all of us as a community understanding a bit more about what it is like to have, an illness that maybe doesn't necessarily have a specific treatment course, or that's complicated and ebbs and flows and all that stuff, right? That can happen with all different kinds of chronic illness. I think we often take for granted this is my little soapbox, that, you know, medicine knows so much, and we know so much through science and medicine and whatnot, but not everything is, as simple as, just take this pill or we'll just bandage it up. And I think this is a big lesson for all of us to sort of take in about all of that. So, there's still a lot we don't know, and there's a lot that we do, and it's sort of finding the balance in it all and maintaining our sanity through it. So
yes, absolutely. Yeah, I know there have not been many straightforward answers this past year, and you're right. I think that has brought up a lot of focus on mental health, which so maybe a silver lining of, we're talking a little bit more about it, because we've just been kind of unable to avoid that any longer.
Absolutely. Well, it's been such a pleasure having you here, Dr.
Thank
Graham.
you.
I am so excited to have you on our team. If people have questions about, more about you and your work, they can visit our website, www.coronadopsych.com. We certainly look forward to hearing from you and doing the best we can to help. So
yes. Thank you so much for having me.
Yes. And we'll see you again soon. Bye.
Bye.